Your news, your views, your values. This is WMNF Tampa 88.5 FM.
The opinions presented on the Healthy Steps show are the evidence-based opinions of Dr. Fred Harvey, the callers, and his guests. These are not the opinions of the staff, the volunteers, or the board of WMNF. The information provided on the show is not intended to diagnose or treat any disease. There is no implied patient-physician relationship in these calls. The nature of the calls is educational and informational only.
Good morning to you. Yes, you, my dear friend, whom I only see in my dreams, but I know I will find in my heart every Monday because we share the same wavelength. WMNF Tampa, the only station that they stream in Yamatsu, Hirosaka, and you can stream us as well at WMNF.org. Well, spank my butt and call me Sally. Today is Ask Me Anything Monday. I always feel like we're spelunking in a gold mine on AMA Monday. The questions that your listeners ask are always a fist-sized nugget that make the Healthy Steps radio show sparkle. Okay, my companions, if you have any questions or any related health concerns, give us a call at 813-239-9663. Irena's sitting in the control room awaiting your call with bated breath. Again, that number is 813-239-9663. You can also send an email to dj@wmnf.org or text us at 813-433-0885. Good morning to you, Dr. Harvey. Ask Me Anything Monday always seems to have legs of its own, so let me get out of the way and watch where this show goes. It's all yours, Dr. Fred. Take it away.
Well, thank you, Bill, and welcome, everybody. Glad you tuned in today. The news just never stops rolling. So many people are doing research, and so many people are publishing such amazing information for us. And, dementia is a recurrent theme. So many people talk about it because so many people are at risk for it, and so many people already have it. Dementia is a not well circumscribed issue. Dementia is a multifactorial illness, and there are many ways to get decreased cognitive function, which is what dementia means. Your brain isn't working, you're not able to think, you lose memory. Early stages of it might be something like brain fog. And we're finding that many people are at risk for a variety of reasons, but they all boil down to inflammation and toxicity, which is what I talk about regularly, because toxicity creates inflammation, and inflammation creates more toxicity. It's a feed-forward loop of destruction in the body. And dementia has some, obvious issues that trigger it, and they definitely are related to inflammation. And inflammation can be caused by so many different things. I mentioned toxicity, but you can lack nutrients to be toxic. You can have too many nutrients and be toxic. And so one of the things they found out more recently is that fiber is a very important nutrient. It's got a faddish name called prebiotic. The reason it's called that is because you eat these fibers, soluble fibers. They are prebiotics. They feed the probiotics, the microbiome, the lactobacillus and bifidobacterium and things like that help to grow a better group of bacteria in your stomach that support your metabolism. Supporting gut metabolism reduces inflammation. It changes the way you metabolize sugar. It alters your sleep patterns. And all of these things are actually related to dementia and the risk of getting dementia. Recent studies have shown that psyllium husk, branded Metamucil, I prefer to use organic, unsweetened, unflavored psyllium husk because the artificial flavor and artificial sweeteners in the branded stuff are toxic for your microbiome. So they're not really as helpful. They're bad for your body too. But fiber has been shown to really improve function. In fact, they did a study in rats where they can actually biopsy the brains, and they saw that there was less white matter, the thinking part of the brain. There was less white matter damage in rats that were treated with fiber compared to ones that got no extra fiber in their feed. That's a really simple ad. It's suggested that we get something like 28 grams of fiber as a minimum per day. Well, in several African nations, they get in excess of 100 grams of fiber a day, and they have some of the least amount of Alzheimer's disease on the planet. So if you want to get some more fiber in your diet without just taking a scoop of something like konjac root, which is another konjac, konjac root, that's a great source of fiber. Psyllium husk is a great source of fiber. Flax seeds, but whole grains, bran cereal, beans, lima beans have lots of fiber. Lentils do too. Black beans, artichokes, and Jerusalem artichoke is another similar vegetable. They have lots of fiber in it. Guava, great fruit with lots of fiber. Bananas, broccoli, especially broccoli stems. Kohlrabi, K-H-O-L-R-A-B-I, I think it's spelled, or K-O-L-R-H-A-B-I, one of the two. It's like a broccoli stem, solid, soluble fiber. Berries, blueberries are full of fiber. Raspberries are too. Popcorn can be. Pumpkin seeds and nuts. So fiber is really, really useful. And they did another study recently that showed that fiber supplements increase bifidobacterium. That's one of the most beneficial bacteria in your gut microbiome. And what they found out when it did that, you had the subjects had increased cognitive performance. Think about that. You take some fiber and you think more clearly. Maybe it's because you're taking out the garbage. And, they've done a lot of work with type 2 diabetes. And for the last 10, 12 years, we've been talking about, in functional medicine circles, we've been talking about how dementia, Alzheimer's dementia, appears to be type 3 diabetes. Because diabetes and the inappropriate, erroneous sugar metabolism affects the way the brain works directly. And they've just done another recent study that shows how the anterior cingulate cortex, which is this communication gatekeeper, it helps regulate your consciousness activity. It's in an area called the hippocampus. And the hippocampus is the area that's most frequently first affected by Alzheimer's dementia. So what they found out is that the diabetes affects this anterior cingulate cortex in the hippocampus and reduces its processing ability. So here's first physiologic evidence of the target in the brain where the brain starts to dysfunction due to diabetes on its slippery slope down towards Alzheimer's dementia. Things that are so simple to do to affect type 2 diabetes are to add fiber to the diet. It changes the microbiome. It improves your insulin sensitivity. It creates acetic acid, which is a helpful metabolite for muscles, so you don't need as much sugar. But exercise 30 minutes a day has been shown to turn back type 2 diabetes and reduce your risk of progressive dementia. Sleep is critical. They actually just did another study. It's so amazing what's coming out now. Sleep deprivation. When you look at the overall cognitive performance, sleep deprivation is worse than alcohol use when you get up to blood alcohol levels up to 0.2. And so sleep is critical, and sleep deprivation disturbs your microbiome. Your gut microbiome is disturbed by insomnia. So here's another connection about how important the microbiome is to keeping you stable. One of the things that helps keep the microbiome stable is the Mediterranean diet. Mediterranean diet is the human diet. It's been used for millennia, and it's the diet that's associated with the best healthy longevity, where your health span equals your lifespan in places like the blue zones. And so these are really important, simple interventions. And I think that there are some more invasive things we could do. Another study about dementia shows that people who have had shingles shots do better. They did a really interesting natural experiment, essentially. They looked at populations in the UK, and they saw that the National Health Service provided herpes zoster or shingles vaccines up until a specific age. They showed that there was almost zero vaccination after that specific cutoff, and there was 50% more in the week prior to that cutoff. So lots of people jumped in right before their birthday to get this shot, and they compared these two populations. What they found was shocking. Over a 7-year interval, there was a relative risk drop of 20% by getting the shot. This tells us two things. One, that we know that shingles is associated with Alzheimer's dementia. We have many other studies that show that actually keeping shingles out of the brain, treating shingles, using vitamin D to suppress shingles, so many different things that help with getting rid of herpes zoster or blocking it will actually help with dementia. And so it may be valuable to look at getting a shingles immunization to help overall with function. And so understanding that, I'm really happy to talk with y'all about that. But in the meantime, I just want to remind people that you can call to interact on the show. The number is 813-239-9663. The email is dj@wmnf.org. Text is 813-433-0885. I can't answer texts after the show is over, so it's best to send an email if you want to get answers anyway. But I do believe that we have a caller on the line. Is Jerry available?
Jerry.
Yes. Hello, Dr. Harvey.
Hello, Jerry.
Yeah, hi, Dr. Harvey. I have an upcoming procedure coming up. I have to go under anesthesia. I wonder what your recommendations is before and after anesthesia to recover and to go through it.
Well, what kind of anesthesia are you going to get?
I believe it's going to be general anesthesia.
Oh, okay. Yeah, not knowing your genetic makeup, I would suggest that you do some liver support to process some of that toxic material to get some of that stuff out of there. You can use some nutritional supplements like N-acetylcysteine. NAC helps to bind up toxins. It helps to create glutathione. That can help remove petrochemical toxins like anesthesia out of your body. You could add to that some alpha lipoic acid, some milk thistle. Make sure you drink lots of fluids, get good protein the day before the procedure. And you might want to take a detox remedy, like a homeopathic remedy, like drainage, or even take some arnica as a homeopathic to help with the trauma of the surgery. But yes, these are all things that could help with your recovery.
Okay, well, appreciate that. Does drainage, is that available over counter? Or?
Drainage, you can get it at some functional medicine doctors. You can get it at some pharmacies that carry Zymogen products. That's Xymogen. And you might be able to purchase it online, just Drainer or Drainage. It's a homeopathic remedy.
Okay, very good. Well, I appreciate your information. I'm going to apply it to my upcoming procedure. Thank you so much.
You're welcome.
All right, bye-bye.
Bye-bye. I think Sarah's on the line.
I'm here.
Hello there.
You started off with dementia today because that was my question. Recently learned about, I know is it over 100 types of dementia out there now? But I recently learned about Pike's disease, and I wanted to know what you know about it.
Would you repeat what you found out about?
I just know it's a behavioral variant of dementia.
So what did you call it?
Pike, like in Peter, I-K-E, Pike's disease.
I think that's Pick's disease.
Oh, is it? I thought it was P-I-K-E. No?
It may be. There's also a Pick's disease that causes dementia. Um,
Okay, I
and
could be wrong.
so these are actually um, neuro, yeah, it's okay. Pike disease can refer to Pick's disease, frontotemporal dementia, or um, pike-fry rhabdovirus disease affecting young pikefish. So I think we're actually talking about Pick's disease. Pick's disease is a type of frontotemporal dementia. So it is a severely progressive neurodegenerative illness that resembles Alzheimer's disease, but is significantly different, has different neuropathological features. It affects younger people and is more associated with a progressive aphasia and very bizarre behavior. I've had one patient with this, and it is there's no known cause except for some genetic predisposition, and then there's probably a trigger similar to what will be triggering the Alzheimer's disease.
Okay. I just wondered. It was the stuff I saw on it. Like I said it was I don't know if it's a rarer type of dementia, but like you said, it has one of the main symptoms is, I'll just call it aberrant behavior. And
yes, that's exactly it.
Interesting. Yeah, I thought that was interesting, as well as the fact that it's because of the behavior, it's behavioral based rather than, let's say, memory based. I guess people's memories don't go with that kind of Alzheimer's or dementia.
Oh, they tend to lose executive function. They can't figure out what to do next. But the key is that in addition to the other neurodegenerative issues, they develop apathy, strange emotions, compulsive behaviors, loss of inhibition. Frontal dementia is associated with loss of inhibition. It's actually the way people who get drunk act, because you cut off your frontal lobe. You no longer have critical thought when you're drunk. And so the loss of inhibition is evident. People who are drunk do stupid, risky things. And that's what happens with people with frontotemporal dementia. They don't need any alcohol. Their brain just doesn't work.
Yeah. Okay. Thank you.
You're very welcome. And Chris, were you all in line?
Yes, thanks so much. I had two quick questions. I appreciated your show very much over the years, and thanks to WMNF for supporting it. And you mentioned a study that had to do with getting the shingles vaccine, and the methodology sounded like it was picking people right and after a cutoff. I'm forgetting the statistical name for that kind of analysis, but I remember it from statistics class. My question is, do we have a mechanism that we know that shingles is interacting with dementia, or could it just be that people who are on the ball and organized and rush to get that shot at the last time are also the people that have all those other good habits that would tend to stay off dementia? And then my second question is if you've ever heard of a company called Simple Smart Science among the various companies that are out there, and if you think that their supplements are worthwhile. And if you haven't heard of them, don't worry.
So, no, I have not heard of them. But to understand the mechanism of why this would be important, I think it was about 2010. You should maybe consider looking up David Perlmutter, Perlmutter, brilliant neurologist. I'm working with him on a project right now to figure out how to use GLP-1 agonists in treating dementia. There's lots of evidence now online that it can do that. However, he actually presented at one of the great conferences I went to where he was teaching some information about herpes zoster, shingles, and dementia. And there was a study done where they took specimens of people who had died with dementia and looked at their brains, and they did special staining. And they did staining of amyloid And amyloid is the inappropriate protein. It's actually inappropriate protein production. It's an anti-inflammatory, antiviral protein that is produced in response to this inflammatory problem. And they showed that in the area, they stained the brain for both herpes zoster on one set of slides, and they stained the brain for the amyloid on another set. And when you overlaid the slides, the amyloid overlaid the herpes zoster. Amyloid is likely a protective mechanism against an invasive infection that's eating that piece of the brain. And what they found out is that everybody who has gone on to these therapies where they try to dissolve the amyloid protein out of the brain, they've had probably 150 of these chemicals that they've tried to get rid of this protein. Every time they've done so, people have gotten worse. It's as if they're releasing the zoster or whatever else is trapped into the brain so it can continue to eat the brain. This is a protective mechanism likely, and we're trying to treat it, which is why every one of these medications has failed so far.
Wow.
Yeah, it's pretty sad. They're missing the point. They keep developing the same medication over and over again. Alcoholics Anonymous realized this problem. You know, what is the definition of insanity? Our medical system. Doing the same thing over and over again and expecting a different result. Problematic, isn't it?
Yeah, well, thank you. Thank you very much. Yet another reason for anyone who is wondering if they should get the vaccine to get it.
Yeah, vaccines work. Not all the time, not everyone, and they're not all appropriate for every person. You know, people with immune suppression like HIV cannot get the first iteration of the shingles vaccine because it's a live attenuated virus. But the new one is simply an in-lab created protein that triggers the same thing for the patient. So the new Shingrix vaccine is the safe one for everybody.
Well, thank you very much.
You're very welcome. Mark, are you on the line?
Mark.
Hello?
Hello, Mark.
Hey. So I'm 36 years old. I vape. I would love to stop vaping. What's your advice? What do you think is the best way to stop using nicotine?
There's a lot of different advice out there. Vaping was supposed to be one of them, but it's equally addictive and probably more damaging. I just saw some studies about how it's kind of plasticizing the lungs. But in reality, they're finding that even Ozempic might help you do this. So I think there's a lot of methodology out there. You can try hypnosis, you can try acupuncture, you can try your own meditation, which is in a sense a sort of self-hypnosis as you focus with intent on things. But you may try a patch, you may try the gum. The gums taste terrible, and so you may actually get over using that versus the vape after a shorter period of time.
Okay, yeah, the gum does taste pretty bad.
Yeah, so it'll deter you from regularly using it if you just need to get off the nicotine. That would be probably a really simple way. It's like, oh, I hate this gum, but it's helping me get rid of my cravings. And then once you get down to whatever, one piece a day, you're probably going to be getting rid of it.
All right, well, thank you for the advice.
You're welcome. Good luck on that.
Thank you.
So is Daniel on the line?
Yes, he is.
Hello?
Hello, Daniel.
How are you?
Great. How are you today?
I'm all right. Getting a little soggy out here, but
Yes.
I just wanted to get your opinion on, say, 3-day fasting. Do you have any thoughts on that, if it's beneficial or not, or just a waste of time?
Well, I just read a study that showed that doing intermittent fasting may actually have adverse results on your gut microbiome. If you do it regularly, often, I think that doing periodic fasting is not a problem. Even a 1-day fast is effective at clearing out the system. Do you need to know more than that? I'm not really sure. Juice fasting is even worse because you're just putting sugar in your gut, and that really trashes the microbiome. So doing a day-long fast, even a 2 or 3 day fast, as long as you're getting lots of water, isn't a terribly bad thing to do. But what you're doing is depleting your liver of the resources it needs to do the detox. That's going to happen if you start losing weight on a fast. So the longer you do the fast, the more toxins you mobilize from your fat, the more you need good protein in your liver to do the detox. And so if you're not getting food while you're doing it, there's a possibility you'll go into a kind of toxic crisis as you're eliminating some of this stuff. So it's best to do things like that judiciously, and maybe a 1 day fast each week would push you on that direction, safer than doing longer fasts.
Yeah, that was going to be my next question. How often would you recommend doing something like this? So you're saying maybe 1 day, once a week?
Yeah, it's not unreasonable.
Okay. All right, great. Thanks for your advice.
You're welcome.
Bye.
Bye-bye. And what does Karen have to say today?
Yes, about the dementia. I've been telling people about keeping their ferritin levels and B12 levels at the upper ranges to prevent thyroid issues and mental and physical health issues. My uncle last year was diagnosed with sudden onset dementia from low B12 levels. He was extremely low. And I'd been trying to tell him for 4 years, I could tell by looking at him, that he was low in iron and low in B12, because most of the time they go together. But
yeah, it sounds to me like he had some gastritis problems, which decreases your ability to absorb both aspirin and B12. Chronic gastritis will do that.
Oh, well, that's very possible. But anyways, also on the dementia, been reading a lot about the studies that they know now, HRT, hormone replacement therapy, greatly reduces dementia. Low estrogen levels greatly affect the neurotransmitters in the brain, and more women get dementia than men. And so I just wonder what you know about that. I've been reading a lot about that the last few years.
Hormone withdrawal is I believe, there's 4.5 subtypes of what's been described as Alzheimer's dementia in the book End of Alzheimer's by Dale Bredesen. And I think type 2 is hormone withdrawal. And yes, so if your organs have failed and you don't have any hormones on board, you will have dysfunction. That's very true. And the use of hormone replacement is often helpful. And it's been shown, though, that when people use synthetic hormones, they have problems. The Women's Health Initiative revealed to us that when you use a medication called Provera or medroxyprogesterone, which is a synthetic hormone that was developed because they could patent it and make money on it. So they chose to give this to women and found out that it was responsible for a 30% increase in dementia, a 30% increase in heart attack, a 30% increase in breast cancer. And so you want to avoid synthetic hormones and use bioidentical natural progesterone, natural estradiol as the hormone replacements, because the standard stuff that's been used for years on the market and still on the market, even though we have this evidence, the FDA went to bat and protected the company that made Provera. It's still being given to people. In fact, it's given to young women as a 3-month anti-pregnancy shot. It causes very bizarre thinking, emotions, and behavior, but it's still used because, well, it's available. Why not try it?
Right. Yeah, and that's probably more the progestin, which is and you want them 100% micronized progesterone.
Well, micronized or not, what you want is bioidentical progesterone.
Right, which the 100% or the micronized progesterone is the bioidentical. It's the same molecular cell.
Well, micronized doesn't mean bioidentical. Micronized means that it's been processed to a very fine particulate. Bioidentical means exactly like in nature.
Right. Yes. Well, an HRT can greatly reduce depression and anxiety for women because during menopause, actually before menopause, women lose 75% of their progesterone before menopause, which makes you estrogen dominant and which causes, most women to have depression, anxiety, not sleeping. And progesterone protects your breast and your uterus and greatly prevents cancer. So,
well,
yes,
it does have some of those properties, but it depends on the person and how toxic and how inflamed they are, because progesterone can still metabolize into estradiol, and it can still actually increase your risk of problems if you're not metabolizing the estradiol appropriately. So hormone replacement therapy is something that I reserve until people are actually clean. I don't put hormones on board first generally, with the exception of an occasional progesterone in someone who has extreme insomnia. But you are so correct that we need to actually look at these things differently.
Yeah.
There's no doubt.
Yes. Well, especially, with your ovaries being removed, you now have lost your testosterone and estradiol. And
Actually, you've lost progesterone. If without ovaries, you've lost progesterone and estradiol. Testosterone is still made in the liver from DHEA. And so it gets really complex, and I really appreciate your input on it.
Our ovaries make 3 to 4 times more testosterone than estrogen. So when you lose your ovaries...
so the testosterone is still made in the liver, and women that I see rarely ever need testosterone replacement because the body makes it out of the available residual hormones. Thanks again for your input, Karen. I think Fred is waiting on the line in Michigan.
Okay, very good. Enjoy listening to you. Thank you.
Thank you.
We actually lost Fred. We got John on the air.
Very good. Hey, John, before we talk, 1 second, I'd just like to remind everybody, I think we have lost a few calls. In the meantime, it's 813-239-9663. This is the Healthy Steps Show with Dr. Fred Harvey, and I am taking your calls now. So, John, what do you have to tell us?
Yeah, Dr. Harvey, I was listening to that guy talking about vaping and seeing how to try to quit.
Yes.
I dipped snuff for 45 years. You know what that is?
I do. I'm from Appalachia.
Okay. I dipped it for 45 years. In the end, I was doing 2 cans a day.
Wow.
I woke up one morning, this has probably been 15 years ago, decided to quit, never looked back. Never even had the urge to go back.
You are a strong man.
I don't know why, but like I said, I never wanted to do it again. I just woke up one day and quit.
And that is a mindset. If you just want to quit, you can do it. It's very difficult with addictive substances, but it is your willpower that ends up overcoming many of these things. But because of addiction, the will deteriorates. And so sometimes we need support. But I like your approach, really cold turkey, all or none, just do it. I've heard many people have done that. It's just so difficult for most.
Yeah. No, but I just thought I'd mention that.
Yes, thank you. Most appreciated. Appreciate your input.
Have a great day.
You too. Have a great week too. Right. So do we have another on the line?
Yes. So we got Lancaster on the air.
Excellent. Lancaster, how are you today?
I'm fine this morning, Doc.
What do you have for us?
What it is, I'm getting ready to have a prostate exam, and I want to know your position on, is they really affected or not? Or
so you're going to have a physical exam by a doctor?
Yeah, I don't have that on schedule for the exam.
So no special procedure or anything, right?
Yeah, I'm going for the biopsy.
Oh, a prostate biopsy. Yes. So those are necessary to evaluate the nature of the cells in the prostate. The reason you're going for a biopsy is somebody thinks you might have a cancer there, probably. Is that right?
Believe so.
Okay. So there are a couple approaches to that, but to get Medicare or any insurance system to pay for any therapy related to this problem, you need the diagnosis of prostate cancer for them to pay for the higher level therapies.
I'm going through the VA. I'm a veteran.
Yes. So the VA will need that data to proceed with ongoing therapy. They're very traditional. They're very conservative. Their treatment practices are about 20 years to 30 years old because the system moves bureaucratically slow. And so they're doing things the way they did back in 1999 or 2005. And so you're going to get a biopsy. They're going to tell you probably need to have either if it's cancer, a prostate removal. They aren't doing as many of those anymore. They're tending to do more local therapy. So radiation is another thing. Hormone manipulation is another. But the VA is going to require that you get this biopsy done to see if you have the disease because it's very disease oriented. In a functional world, you might get an MRI of the prostate to see if they rate it as a high risk lesion. And if you're not in the VA, there are other options for treatment besides what they're going to offer. There's a cryotherapy where they freeze the specific tumor rather than doing radiation or taking your whole prostate out. And there's another one called HIFU, high intensity focused ultrasound, where they actually burn the specific piece of the tumor out. And so I would let the VA tell you what they find and then use their information to help you make some decisions.
Okay, let me mention this. I have a pacemaker and I can't do no MRI.
Oh, okay. So yeah, you'd probably just have to go with the biopsy then.
Go straight to the biopsy.
Yeah, if you can't get an MRI, that would be the next step.
Oh, okay.
So you're on path for the right approach for what you got.
Oh, okay then. All right. I just want to listen to you all the time and started out with Eve and it got you now.
Wonderful. Glad you're listening. And best wishes with that. I think you're going to do fine. The VA does do good work. It just takes the bureaucracy to move to get it done.
Yeah. I'm looking at about a month and a half.
Yeah, and unfortunately right now we have a destructive administration in Washington, D.C. that's planning on completely dismantling the DA and turning it into a private system where you'll get less care.
How about that?
Aren't they wonderful? And so many vets voted for these people. I wonder why.
Hey, they're going to feel the problem.
I think they are. And, well, that's what happens. We have another one on the line, though. Good luck with that, Lancaster. I hope it goes well for you. I think it will.
All right.
Dana is on the line.
Hi. Oh, hold on. My phone's... Okay, can you hear me?
I can.
Okay, I couldn't hear you for a moment. So I came in late to what you said about the hormone therapy. I didn't hear that most women don't need it. I wanted to find out, my daughter went through an experience where she had a complete hysterectomy, and she started having psychotic episodes where she was seeing things. She thought people were shooting lasers at her.
How old was she?
She is around 40.
Okay. That's a really odd event. But no, I didn't say that most women don't need hormone therapy. Most women don't need testosterone because they don't need high levels of it. I find that women who get support with estrogen, estradiol specifically, progesterone, and DHEA, dihydroepiandrosterone, actually make enough testosterone that they don't really need to have it replaced. But I do believe that hormone replacement therapy is useful in the perimenopause period for many, many women, and in fact, may even reduce your risk of breast cancer.
Oh, okay. So as far as, because right now she's on psychotic medication and antidepressants.
Yes. Did anyone do a diagnostic to see why she has this problem? Because antipsychotic medicines, will stop the weird ideas or hallucinations maybe, but why does she have this?
Yeah, I don't know. She was put in a facility by the police. She was Baker acted by the police. And then she voluntarily went on to a second facility. I don't know that anybody did any extensive. She did tell them that the symptoms didn't start until after her surgery.
Yeah, well, they didn't do any checks. They didn't. They don't check hormones, and she needs a hormone check, preferably a urine or saliva one because you get better information there. But even a serum one would be useful, but they're not likely going to do it in a psych ward. They won't check her neurotransmitters because psychiatrists don't do their job and they don't actually look at the neurotransmitters in the body. They just use these neurotransmitter manipulating chemicals and have no idea what they're actually doing to the actual neurotransmitter levels. It's really a weird black box kind of game they play. But yeah, I think your daughter deserves a metabolic workup. She deserves a hormonal workup. She deserves a neurotransmitter workup, and she deserves a vitamin workup to find out if she has any deficiencies. I mean, your brain doesn't work if you have 0 fish oil. Your brain doesn't work if you have 0 vitamin D, vitamin B12. So are they doing their job? No, because they're just putting her on antipsychotic and antidepressant medicines.
Okay, and a functional medicine does all of those?
Absolutely.
Functional medicine doctor? Okay.
Yes.
Okay, well, that's what I'm going to try to get her to. Okay.
Yeah, you need to get a real healthcare practitioner, not a psychiatrist.
Right. I agree. Okay, well, thank you. I appreciate it.
You're welcome.
Bye.
Have a good week and good luck with that. Best wishes. Diana, or Diane, are you on the line?
Yes, I am. I'm wondering, good morning. Wondering if you have any anything you could recommend in supplements to reduce plaque in arteries.
Well, plaque in arteries, that's an interesting question. Plaque in arteries is actually spackle. And so the real treatment is figuring out why it is you've denuded the lining of your arteries with inflammation to need spackle.
Right.
And so there's no magic bullet. Functional medicine doesn't work by this supplement's going to take that away. That's how I started this stuff in integrated medicine. Integrated medicine means you take away this medication and you add in this supplement over here instead of the medication. And basically you're still doing illness care medicine. But wellness care or health care actually evaluates why it is that you actually have plaque and treats the why, not the what.
Right.
And so we have to look at what's your metabolome look like. The metabolome test from Genova Diagnostics looks at, it's called the Nutra Eval, and it looks at your biomarkers behind the scene in your mitochondria, in your brain, in your gut, in your structural proteins, amino acids, fatty acids, and looks at all the balance to see if things are working right. And then we work on the balance. You look at B12 and vitamin D levels, omega-3 fat levels. There's so many things that we can intervene with that are likely causative in problems like this.
Right. Okay. Thank you.
Yeah, I would go and find a good functional medicine doctor and talk with somebody about how to actually approach this rather than just doing standard illness care and take a statin.
Right, that's what I'm looking into.
Because statins do reverse the plaque.
Right.
But for me, that's the last thing. I mean, medication is before surgery, the last two things you consider. And then the very last thing is the radiation.
Yeah, don't want to go there.
Right.
Okay, thank you. Thanks for your
You're
help.
so welcome.
Okay, bye.
Hey, Tony's on the line. What do you have for us today, Tony?
Tony, you're on air.
Yes, I am. Hi, good morning.
Hey there.
You had mentioned to a previous caller with a pacemaker that you confirmed his statement that he could not get an MRI because of that. There are pacemakers that are MRI compatible, and the radiology department has to switch them into MRI safe mode. So
that is very true, but it's likely that this guy had his pacemaker put into the VA and they used the very cheapest one possible.
That's not necessarily the case. The VA does produce very good medicine.
They do.
If he does need an MRI, I think it's a little unfair to leave him with the impression that he can never get an MRI. He certainly can. From the last 10 years or so have been MRI compatible, and the radiology department that works with them can switch him into MRI safe mode. So if a gentleman needs an MRI for any reason, not necessarily just his prostate, his radiology department can interrogate his pacemaker and his paperwork and see if he can get one.
Excellent advice, Tony. Thank you for that.
Okay.
Have a great day. Well, I think we're out of callers at the time.
Mm-hmm.
So it is 813-239-9663. I can take some more calls before we're done. We have about 9 more minutes. In the meantime, I'll answer some emails. Here's one. Elsie asks, is it best to take probiotics on an empty stomach? Actually, I tend not to do that because we didn't really have probiotic capsules in the past. We ate them in our food. And so I usually take probiotics with food because they tend to actually help us metabolize our food. And so only occasionally would I take them on an empty stomach because I really want them to actually be involved with the digestion of the food. Here's one from Peter. What is the difference between dementia and Alzheimer's? So dementia is basically cognitive decline and inappropriate cognitive function. But Alzheimer's is simply a classification of types of dementia and specifically refers to a pathologic problem where we found these certain chemicals like amyloid beta and tau protein that are and something called neurofibrillary tangles, the unraveling and destruction of the nerves. And so these things we see actually as a regular occurrence in Alzheimer's, but not in all types of dementia. As we talked earlier about, Pick's disease is a type of dementia that's not Alzheimer's disease. And we have a caller. Chris, what do you have for us today?
Autoimmune arthritis, such as rheumatoid arthritis and psoriatic arthritis and ankylosing spondylitis. Is there a functional medicine role? I've had really phenomenal help from the biologic medicines, and I try to, of course, exercise as much as I can and eat the Mediterranean diet, as you said. But are there other functional medicine things that should be considered?
Yes, absolutely. I think that anybody who's on biologics for a autoimmune disease really deserves to have a metabolomic workup to see what's in or out of balance. So many things can make an impact for you. And many of these autoimmune degenerative diseases have triggers in the gut. Certain bacteria can make ankylosing spondylitis worse. I believe it's Klebsiella pneumonia triggers a flare of that. And so it's worth it to look maybe at a gut survey, a metabolomic survey like the NutriVal, and even doing some food sensitivity work, checking your gluten sensitivity or the multiple versions of wheat sensitivity that can occur. Vibrant America does a great lab called the Wheat Zoomer, and it actually checks you for a leaky gut as well. Leaky gut equals leaky brain. So you can get destruction, and also leaky joints. So you can get destruction all over your body if your gut is leaking. And so there's so many things that functional medicine can help. I've watched people get off biologics when they clear up the problems that are actually triggering their autoimmune problems.
The first thing was a metabolic workup. That's what you said?
Yes, a metabolomic workup. The metabolome is the stuff that goes on behind the scenes. To see if things are working right. The Genova Diagnostics does a test called the NutriVal, which looks at those behind the scenes chemicals.
Thank you.
You're welcome. And best wishes on pursuing that. We have a couple more callers. Nina, what do you have for us today?
Quick question. I missed the name of that test regarding the arteries. The plaque in the arteries, the Geneva that you recommended, that would be good to have.
For plaque in the arteries is another test you could look at. It's Cleveland Heart Labs. Quest Labs offers it. Cleveland Heart Labs looks at 6 different inflammatory markers to determine progression of plaque inside your arteries. But the NutriVal, NUTREVAL from Genova Diagnostics is a metabolomic test that I use on every one of my functional medicine patients because it gives such valuable behind-the-scenes data about what we need to do to intervene to make the body work better.
Okay, it's by Geneva Diagnostic. It's called
Genova. Genova. Genova.
Okay. Okay, great. Thanks a lot. I appreciate it. Thanks for the show. It's awesome.
You're welcome.
All right. Bye-bye.
Bye-bye. Hey, John, I think you're on the line. What do you have for us today?
Hey, Doc. Just a couple of questions. I've always been very healthy, but getting ready to turn 65 and recently been diagnosed with somewhat high blood pressure, and they also say I have pre-diabetes. Just wondering if you could recommend some life changes I could make to keep those things in check.
So pre-diabetes, high blood pressure, what else?
That's pretty much it.
Okay, good. Are you overweight at all?
Not really.
Okay. So prediabetes and high blood pressure go together quite often. Metabolic syndrome X is a system where you get insulin resistance and then you develop cardiovascular disease. The potential interventions for that are, one, check out and see if you have sleep apnea because it's a cause for it. Second thing would be look at a Mediterranean diet, 30 minutes of walking every day, and taking some basic supplements like a multivitamin, a good probiotic, and some fish oil and vitamin D.
Okay. All right. I do the fish oil, and I'll have to add vitamin D. So the Mediterranean diet and exercise.
Absolutely. Very critical stuff. And then work on the rest of the stuff. Look at a lipid breakdown test like the Boston Heart Labs cholesterol balance test or the advanced lipids from Quest. A Cleveland Heart Labs test will give you vascular information data. An insulin and a glucose, fasting glucose, will tell you if you're having problems with insulin resistance. And a uric acid test will tell you also if you're having problems with the same system. So there's lots of things you can do to look at what's going on and then intervene even more directly.
All right. Well, I've never gone to the doctor real regularly, but starting to have a few things that I need to have taken care of. But I appreciate the advice. I try and stay away from any prescription meds. But
yes, but get yourself a good healthcare practitioner like a functional doctor to get yourself moving in the right direction. That's the kind of doctor you want to see, not one that's just going to treat symptoms. But thank you very much. We're down to the last minute or so. I'm going to start answering some emails and no more calls today. Try again next week if you'd like. Patty asks us, what's my take on Benefiber? Benefiber is a good soluble fiber. I think that's fine. Wheat dextrin, that is a complex starch from wheat. I wouldn't bother with it because you don't want to be eating the wheat anyway since it's already been sprayed with Roundup. Got a question about lavender food trend. It's very interesting. There's so many things that are coming up with lavender everything. Lavender's wonderful, but should we be drinking essential oils and lavender flavored substances? You really need to pay attention to this because even natural flavor might have weird stuff in it, solvents and other chemicals. Artificial flavors, obviously bad. So many of these lavender things I've seen advertised, they're purple. What is the purple color? Lavender has a nice lavender colored flower, but it doesn't stay purple in water or in a mix. So what chemical are they putting in there? Very big question. I would really question even ingesting a lot of essential oils, even though there are a bunch of essential oil people that say, do it, do it, do it. Terpenes cause allergies and other problems. So we really want to consider whether we want to be doing this stuff. It's 11 and I'm out of here. So, hey, thank you so much. It's been a great interactive show. Thank you, Joe, for running the boards. Thank you, Irene, for taking the calls. And I'll see y'all next week. Oh, actually, no. Next week, I'm away. You're going to get a non-call-in best of show next week. I'll be away. And the following week as well, I'll see you back in 3 weeks for Ask Me Anything show.
This is WMNF Tampa.